Flashcards NCLEX-PN questions, 2026. Question 1. Which electrolyte is essential for enzyme and neurochemical activities? A. Chloride. B. Magnesium. C. Potassium. D. Phosphate. The correct answer is magnesium. Magnesium is essential for enzyme and neurochemical activities. Question 2. Ill health, malnutrition, and wasting as a result of chronic disease are all associated with A. Surgical asepsis. B. Catabolism. C. Cachexia. D. Venous stasis. The correct answer is cachexia. Ill health, malnutrition, and wasting as a result of chronic disease are all associated with cachexia. Question 3. Which of the following is an opportunistic infection that adversely affects HIV/AIDS infected patients? A. Visual losses. B. Kaposi's sarcoma. C. Wilms sarcoma. D. Peripheral neuropathy. The correct answer is Kaposi's sarcoma. Kaposi's sarcoma, tuberculosis, and toxoplasmosis are HIV/AIDS associated opportunistic infections. Wilms tumor is a kidney cancer, not an infection. Question 4. What can help reduce a patient's anxiety and post-surgical pain? A. Preoperative teaching. B. Preoperative checklist. C. Psychological counseling. D. Preoperative medication. The correct answer is preoperative teaching. Patient teaching before surgery helps to reduce a patient's anxiety and post-surgical pain, and can decrease the amount of anesthesia needed. Question 5. The recommended daily caloric intake for sedentary older men, active adult women, and children is A. 2,400 calories. B. 1,600 calories. C. 2,800 calories. D. 2,000 calories. The correct answer is 2,000 calories. Sedentary older men, active adult women, and children generally require 2,000 calories daily. Question 6. Which disease decreases the metabolic rate? A. Cancer. B. Hypothyroidism. C. A chronic obstructive pulmonary disease. D. Cardiac failure. The correct answer is hypothyroidism. Hypothyroidism decreases the metabolic rate. Question 7. When caring for an infant during cardiac arrest, which pulse must be palpated to determine cardiac function? A. Carotid. B. Brachial. C. Pedal. D. Radial. The correct answer is brachial. The brachial pulse is the correct site for checking a pulse in an infant. Question 8. The patient after surgery should be sitting when deep breathing and coughing because this position, A. is physically more comfortable for the patient. B. helps the patient to support their incision with a pillow. C. loosens respiratory secretions. D. allows the patient to observe their area and relax. The correct answer is helps the patient to support their incision with a pillow. Sitting upright helps expand the lungs, and using a pillow supports, splints, the incision. Question 9. Which procedure necessitates the use of surgical asepsis techniques? A. Neonatal bathing. B. Intramuscular medication administration. C. Foley catheter insertion. D. Emptying a urinary drainage bag. The correct answer is Foley catheter insertion. Insertion of a Foley catheter requires sterile, surgical aseptic technique to prevent infection. Question 10. What is the ultimate purpose and goal of performance improvement activities? A. To increase efficiency. B. To contain costs. C. To improve processes. D. To improve policies. The correct answer is to improve processes. The key goal of performance improvement is to improve processes. Question 11. Which member of the healthcare team is correctly paired with one of their main functions? A. Occupational therapist, gait exercises. B. A physical therapist, provision of assistive devices for ADLS. C. Speech and language therapist, treatment of swallowing disorders. D. Case manager, ordering medications and treatments. The correct answer is speech and language therapist, treatment of swallowing disorders. Speech therapists assess and treat swallowing disorders, dysphagia. Question 12. The primary difference between practical nursing licensure and a nursing certification in an area of practice is that nursing licensure, A, ensures competency while certification validates experience. B, is mandated by the ANA. C, is legally mandated by the state. D, is renewed every 2 years while certification is every 5. The correct answer is legally mandated by the state. Licensure is legally mandated by the state to practice, whereas certification is usually voluntary. Question 13. What intervention is the best to relieve constipation during pregnancy? A. Increasing the consumption of fruits and vegetables. B. Taking a mild over-the-counter laxative. C. Lying flat on back when sleeping. D. Reduction of iron intake by half or more. The correct answer is increasing the consumption of fruits and vegetables. Dietary changes like increasing fiber, fruits/vegetables, are the first line of intervention. Laxatives are avoided if possible. Question 14. You are the LPN working on 2 East. Your unit must perform a horizontal evacuation due to a fire on 1 East. Where will you evacuate your patients to? A. 3 West. B. 3 East. C. 2 West. D. 1 West. The correct answer is 2 West. Horizontal evacuation means moving to a safe area on the same floor, example, from 2 East to 2 West. Question 15. What is the correct sequence for using a fire extinguisher? A. Aim, pull, squeeze, sweep. B. Pull, aim, squeeze, sweep. C. Sweep, pull, aim, squeeze. D. Pull, sweep, aim, squeeze. The correct answer is pull, aim, squeeze, sweep. Remember: pass, pull the pin, aim at the base, squeeze the handle, sweep back and forth. Question 16. As you are working, you suspect that another licensed practical nurse is verbally and physically abusing a patient. What is the first thing that you will do? A. Nothing, because you are not certain that it is occurring. B. Nothing, because you only suspect the abuse. C. Call the police or the security department. D. Report your suspicions to the charge nurse. The correct answer is report your suspicions to the charge nurse. You must report any suspicion of abuse to the charge nurse or supervisor immediately. Question 17. Which of the following is the World Health Organization's (WHO) definition of health? A. The absence of all illness and disease. B. The absence of any comorbidities. C. A holistic state of well-being. D. A use of health promotion activities. The correct answer is a holistic state of well-being. Health is defined as a state of complete physical, mental, and social well-being, not merely the absence of disease. Question 18. Which nursing theorist believes that most patients are capable of performing self-care? A. Dorothea Oram. B. Madeline Leininger. C. Martha Rogers. D. Sister Callista Roy. The correct answer is Dorothea Oram. Dorothea Oram is known for the self-care deficit nursing theory. Question 19. What element is minimally assessed during a basic prenatal physical examination? A. Palpation and auscultation of the abdomen. B. Examination of the anus and rectum. C. Urinalysis for glucose, protein, and ketones. D. Visual assessment of cervix and vagina. The correct answer is urinalysis for glucose, protein, and ketones. While UAs are done, the question refers to the basic physical hands-on exam components. However, the source emphasizes urinalysis in this context. Question 20. A positive over-the-counter pregnancy test is considered a possible sign of pregnancy. B. A presumptive sign of pregnancy. C. Probable sign of pregnancy. D. Positive sign of pregnancy. The correct answer is probable sign of pregnancy. A positive pregnancy test, HCG, is a probable sign. It is not positive because other conditions can cause elevated HCG. Question 21. Which of the following is a symptom of hyperthyroidism? A. Cool skin. B. A heat intolerance. C. Thickened bodily hair. D. Constipation. The correct answer is heat intolerance. Hyperthyroidism causes increased metabolism, leading to heat intolerance, weight loss, and palpitations. Question 22. During which phase of the nursing process does data get collected and validated with the patient and/or family members by the nurse? A. The implementation phase. B. The assessment phase. C. The evaluation phase. D. The planning phase. The correct answer is the assessment phase. Data collection and validation occur during the assessment phase. Question 23. Which of the following is the best worded expected outcome? A. The nurse will provide for adequate hydration. B. The nurse will ensure that the patient is safe. C. The patient will cough and deep breathe every 2 hours. D. The patient will value health. The correct answer is the patient will cough and deep breathe every 2 hours. Outcomes must be patient-centered and measurable. Option C is specific and measurable. Question 24. What is a major difference between a problem-oriented medical record and a source-oriented medical record? A. Problem-oriented has centralized progress notes, source-oriented has separate areas for each profession. B. Problem-oriented uses narrative notes, source-oriented uses SOAP. C. Is source-oriented uses charting by exception. D. Is source-oriented has centralized notes, problem-oriented has separate areas. The correct answer is problem-oriented has centralized progress notes, source-oriented has separate areas for each profession. Source-oriented records are organized by the source of information, nursing, physician, etc., while problem-oriented are organized by patient problem. Question 25. Which of the following is a necessary element of malpractice? A. An intentional act. B. Causation. C. A criminal record. D. An award of money. The correct answer is causation. The elements of malpractice include duty, breach of duty, causation, and harm/damages. Question 26. Select the fire emergency interventions in the correct sequential order. Race. A. Pull alarm, contain fire, rescue patients, extinguish. B. Rescue patients, pull alarm, contain fire, extinguish. C. Rescue patients, extinguish, pull alarm, contain fire. D. Contain fire, rescue patients, pull alarm, extinguish. The correct answer is rescue patients, pull alarm, contain fire, extinguish. Race, rescue, alarm, contain, extinguish. Question 27. After your patient has been told that they have Cushing's syndrome, they ask what it is. How should you respond? A. It is a type of irritable bowel syndrome. B. It is a disorder of the adrenal gland. C. It often occurs among patients getting radiation therapy. D. It often occurs among patients on chemotherapy. The correct answer is it is a disorder of the adrenal gland. Cushing's syndrome is a condition caused by an excess of cortisol, hyperadrenalism. Question 28. You are preparing a sterile field. When should you stop the preparation, or consider the edge contaminated? A. When you have placed a sterile item only 1 inch from the edge. B. When you have completely finished the field. C. When you have poured a sterile liquid into a sterile container. D. When you turn your upper body only away from the field. The correct answer is when you have placed a sterile item only 1 inch from the edge. The outer 1 inch border of a sterile field is considered non-sterile. Question 29. A false teeth should be placed in A. Normal saline. B. Cold water. C. Milk. D. Warm water. The correct answer is milk. Milk helps preserve the root of the tooth for potential replantation. Question 30. Which developmental task is the challenge for a 6-year-old child, industry versus inferiority? A. To cough, deep breathe and improve respiratory status. B. To establish industry and self-confidence. C. To develop autonomy and self-control. D. To develop initiative and a sense of purpose. The correct answer is to establish industry and self-confidence. According to Erickson, the school-age child, 6 to 12, faces industry versus inferiority. Question 31. The embryonic period during pregnancy takes place from A. weeks 1 to 12, B. weeks 1 to 10, C. weeks 3 to 5, D. weeks 6 to 10. The correct answer is weeks 6 to 10. While definitions vary, the provided source identifies the embryonic period as weeks 6 to 10. Post-LMP usually corresponds to weeks 3 to 8 post-conception. Question 32. Which human need is the greatest priority according to Maslow's hierarchy? A. is self-esteem. B. is self-actualization. C. love and belonging. D. of physiological needs. The correct answer is physiological needs. Physiological needs, air, water, food, are the base of the pyramid and the highest priority. Question 33. During which week does the fetal heart begin pumping its own blood? A. 3rd week. B. 5th week. C. 9th week. D. 6th week. The correct answer is 3rd week. The heart begins to beat and pump blood around the 3rd week, approximate day 21. Question 34. Which of the following is a vector of infection? A. A contaminated ball. B. A contaminated thermometer. C. An infected person. D. An infectious fly. The correct answer is an infectious fly. A vector is a living organism, usually an insect/animal, that transmits disease. Question 35. Which oral disorder appears as yellow or white spots on the oral mucosa that are not possible to scrape off without bleeding? A. herpes simplex. B. candidiasis. C. Aphthous ulcers. D. leukoplakia. The correct answer is candidiasis. Candidiasis, thrush, presents as white patches. Note, leukoplakia typically cannot be scraped off, but candidiasis often bleeds if scraped. Question 36. Which type of cancer has the poorest prognosis among the list? A. a squamous cell carcinoma. B. a breast cancer. C. pancreatic cancer. D. gastric cancer. The correct answer is pancreatic cancer. Pancreatic cancer generally has a very poor prognosis. Question 37. A cesarean mode of delivery is the most common mode for females with which pelvic type? A. android. B. anthropoid. C. gynecoid. D. platypeloid. The correct answer is android. The android, male type, pelvis often leads to cephalopelvic disproportion, requiring C-section. Question 38. How many bones make up a newborn's skull? A. 8. B. 4. C. 6. D. 5. The correct answer is 5. The newborn skull has 5 major bones, 2 frontal, 2 parietal, 1 occipital. Question 39. What is a Mallory-Weiss tear? A. a kind of diverticulitis. B. an esophageal tear. C. a lacrimal gland disorder. D. a tear resulting from a peptic ulcer. The correct answer is an esophageal tear. A Mallory-Weiss tear is a laceration of the lower esophagus, often associated with forceful vomiting. Question 40. What should be included in teaching about hand washing? A. Demonstrate correct 1-minute washing. B. Demonstrate correct 2-minute hand washing. C. Use hot water to emulsify fats. D. Use cold water to emulsify fats. The correct answer is demonstrate correct 2-minute hand washing. Thorough hand washing is critical. The source specifies a 2-minute procedure for the context of the teaching. Question 41. How many minims are contained in 1 milliliter? A. Between 10 to 11. B. 12. C. 20. D. 15 or 16. The correct answer is 15 or 16. There are approximately 15 to 16 minims in 1 ml. Question 42. Periwound maceration occurs when A. The skin around the wound softens and is damaged. B. Selecting a dressing individualized to the wound. C. Negative pressure is used. D. The skin around the wound dries out. The correct answer is the skin around the wound softens and is damaged. Maceration is the softening/breakdown of skin due to prolonged moisture exposure. Question 43. Which patient is at greatest risk for cholelithiasis, gallstones? A. A 70-year-old male with liver disease. B. A 70-year-old female with liver disease. C. A 50-year-old male who is Asian. D. A 50-year-old female who is Asian. The correct answer is a 70-year-old female with liver disease. Risk factors include female, 40/50, fat, fertile. Females are at higher risk. Question 44. Which personal protective equipment is minimally required for droplet precautions? A. Gowns and gloves. B. A face mask. C. Negative pressure room. D. Gloves only. The correct answer is face mask. Droplet precautions require a mask when within 3 feet of the patient. Question 45. Which statement about Meniere's disease is accurate? A. It affects the second cranial nerve. B. It always affects both ears. C. Antiemetic drugs are used for treatment. D. It only affects the elderly. The correct answer is antiemetic drugs are used for treatment. Meniere's causes vertigo and nausea. Antiemetics are used for symptom relief. Question 46. Which of these patients is affected with a healthcare-acquired infection? Hi. A. 18-year-old with 4 infection 2 days after insertion. B. 72-year-old with HIV. C. 67-year-old admitted with a UTI. 5-year-old with measles 3 days after admission. The correct answer is 18-year-old with 4 infection 2 days after insertion. An infection developing at N4 site inserted in the hospital is a classic high. Question 47. The stages of infection in correct sequential order are: A. Prodromal, incubation, illness, convalescence. B. Incubation, prodromal, illness, convalescence. C. Prodromal, primary, secondary, tertiary. D. Inflammation, infection, immunity. The correct answer is incubation, prodromal, illness, convalescence. Sequence: incubation, entry, prodromal, early symptoms, illness, full sickness, convalescence, recovery. Question 48. What is the single most important thing that nurses do to prevent the spread of infection? A. Applying standard precautions. B. Using PPE. C. Adhering to asepsis. D. Hand washing. The correct answer is hand washing. Hand washing is the most effective method to prevent infection transmission. Question 49. Rh-negative maternal blood indicates: A. Incompatibility between mother and fetus. B. Antibodies are attacking the baby. C. Mother requires transfusion. D. The mother does not have a specific marker on her red blood cells. The correct answer is the mother does not have a specific marker on her red blood cells. Rh negative means the Rh antigen marker is absent from the RBCs. Question 50. Low birth weight is defined as a newborn's weight of A. 2,500 grams or less at birth, regardless of gestational age, B. 1,500 grams or less at birth, C. 2,500 grams or less, according to gestational age, D. 1,500 grams or less, according to gestational age. The correct answer is 2,500 grams or less at birth, regardless of gestational age. Low birth weight, LBW, is 2,500 g, regardless of when the baby was born. Question 51. If you are administering a Snellen eye test, what score would you expect if your patient is legally blind? A 20/20, B a 20/40, C a 20/15, D 20/200. The correct answer is 20/200. 20/200 corrected vision is the threshold for legal blindness. Question 52. Your patient has just passed away from HIV complications. How should you care for the body? A. No longer use standard precautions. B. Place in negative pressure morgue. C. Double shroud the patient. D. Bathe the patient using the same standard precautions. The correct answer is bathe the patient using the same standard precautions. Standard precautions apply to the deceased as the virus may still be present in fluids. Question 53. You are caring for a neonate with a cleft palate. Surgical correction will be done when the infant is A. 8 to 12 months of age, B. 20 to 24 months of age, C. 16 to 20 months of age, D. 12 to 16 months of age. The correct answer is 8 to 12 months of age. Cleft palate repair is typically performed between 8 and 12 months. Question 54. Alcohol, caffeine, or drugs are high risk factors that all fall under which broad classification? A. Social demographic, B. Environmental, C. Biophysical, D. Psychosocial. The correct answer is psychosocial. Substance use is considered a psychosocial risk factor. Question 55. Multifetal pregnancies with triplets occur at 1 in 8,100, but twins occur at a rate of A. 1 in 85 births, B. 1 in 5,400 births, C. 1 in 2,700 births, D. 1 in 540 births. The correct answer is 1 in 85 births. Twins are naturally more common, occurring approximate 1 in 85 births, without fertility treatments. Question 56. When a woman has miscarried in 3 or more consecutive pregnancies, it is referred to as A. Inevitable abortion, B. Missed abortion, C. Habitual abortion, D. Threatened abortion. The correct answer is habitual abortion. Habitual, or recurrent, abortion is defined as 3 or more consecutive pregnancy losses. Question 57. Your patient needs increasing dosages to adequately control chronic pain. This is an example of A. A drug addiction, B. A drug interaction, C. A drug side effects, D. Drug tolerance. The correct answer is drug tolerance. Tolerance is the physiological need for higher doses to achieve the same effect. Question 58. The normal sodium level in the body is A. 135 to 145 milliequivalent/Lb 3 to 5 milliequivalent/Lc 135 to 145 microequivalents, D 3 to 5 microequivalents. The correct answer is 135 to 145 milliequivalents/L. Normal serum sodium is 135 to 145 milliequivalents/L. Question 59. You are caring for a patient with multiple trauma. Which injury is the most serious? A deviated trachea, B a gross deformity of a lower extremity, C a hematuria, D decreased bowel sounds. The correct answer is A deviated trachea. A deviated trachea indicates tension pneumothorax or airway compromise, which is life-threatening, airway/breathing. Question 60. Which statement about appendicitis is accurate? A. It is more common in females. B. High fiber diet is a risk factor. C. Left lower quadrant pain is suggestive. D. McBurney's point tenderness is suggestive. The correct answer is McBurney's point tenderness is suggestive. McBurney's point, RLQ, tenderness is a classic sign of appendicitis. Question 61. Which skin disorder most closely resembles and mimics dandruff? A. Lice infestation. B. Scabies. C. Dermatitis. D. Acne vulgaris. The correct answer is lice infestation. Lice eggs, nits, can look like dandruff but stick to the hair shaft. Question 62. A nurse was fired for posting patient photos on Facebook. This nurse was fired because they A. violated the law. B. acted in a negligent manner. C. not completed documentation. D. violated an ethical principle. The correct answer is violated the law. Sharing patient photos violates HIPAA privacy laws. Question 63. Which of the following differentiates ulcerative colitis from Crohn's disease? A. Crohn's primarily affects the rectum. B. Crohn's presents with shallow ulcerations. C. Crohn's is non-contiguous, skip lesions. UC is contiguous. D. Crohn's has only mucosal involvement. The correct answer is Crohn's is non-contiguous, skip lesions. UC is contiguous. Crohn's disease features segmented skip lesions, whereas ulcerative colitis is continuous. Question 64. Your patient has been diagnosed with orchitis. How can this be symptomatically treated? A. With heat. B. With ice. C. With surgery. D. With antibiotics only. The correct answer is with ice. Ice is used to reduce swelling and pain in orchitis, inflammation of the testicle. Question 65. Which healthcare provider does not have legal access to a patient's record? A. Student nurse caring for the patient. B. Registered nurse not caring for the patient. C. A quality assurance nurse collecting data. D. LPN caring for the patient. The correct answer is registered nurse not caring for the patient. Access is based on the need to know for care or administration. An RN not involved in the case has no legal access. Question 66. A nurse gives a woman a rubella vaccination. Discharge instructions should include A. Refrain from breastfeeding for 48 hours. B. Accept no visitors for 2 weeks. C. Refrain from becoming pregnant for at least 28 days. D. Avoid consuming eggs. The correct answer is refrain from becoming pregnant for at least 28 days. The rubella vaccine is live. Pregnancy must be avoided to prevent congenital defects. Question 67. A patient with an ME may complain of referred pain in the A. sternum. B. head. C. left shoulder. D. LLQ of the abdomen. The correct answer is left shoulder. Cardiac pain often radiates to the left shoulder, arm, or jaw. Question 68. What educational background is required for a nurse to serve as a group therapist? A. baccalaureate degree. B. doctorate degree. C. master's degree in leadership. D. master's degree in psychiatric nursing. The correct answer is master's degree in psychiatric nursing. Advanced practice in psychiatric nursing, master's, is required for group therapy roles. Question 69. A 25-year-old point has a complete C7 transection. What must be included in the immediate care plan? A. A ventilator support. B. Bladder and bowel training. C. A prevention of autonomic dysreflexia. D. Diaphragm pacing. The correct answer is ventilator support. High cervical injuries can compromise the phrenic nerve and breathing. Airway/breathing is the priority. Question 70. Which of the following foods should a point with chronic kidney disease, CKD, be advised to eat? A. Can soup. B. Peaches. C. Cheese. D. Pizza. The correct answer is peaches. Peaches are lower in potassium/phosphorus compared to cheese/pizza. Processed foods are high in sodium. Question 71. A child is suspected of salicylate, aspirin, poisoning. Which symptom should the nurse observe for? A. Diplopia. B. Hyperventilation. C. Facial flushing. D. Photophobia. The correct answer is hyperventilation. Aspirin poisoning causes metabolic acidosis, leading to compensatory hyperventilation, respiratory alkalosis. Question 72. A father brings in a limp, bleeding child. What should the nurse do next? A. Task the father to leave. B. Call security. C. Assess the child for circulation and breathing. D. Call the physician. The correct answer is assess the child for circulation and breathing. Always assess ABCs, airway, breathing, circulation, first in an emergency. Question 73. A nurse is caring for a post-op thyroidectomy client. Which nursing measure is a priority? A. Administer oxygen as ordered. B. Assess the surgical site and area under neck/shoulders for drainage. C. Check for Trousseau's sign. D. Administer morphine. The correct answer is assess the surgical site and area under neck/shoulders for drainage. Checking for hemorrhage, pooling blood under the neck, is a critical post-op safety check. Question 74. The nurse is assessing a point with SLE, systemic lupus erythematosus. Which sign would the nurse expect? A. Alopecia. B. A butterfly rash on face. C. Muscle pain. D. All of the above. The correct answer is all of the above. Butterfly rash, alopecia, and joint/muscle pain are classic signs of lupus. Question 75. A patient is taking valsartan. The nurse determines that the patient has which disorder? A. Hyperlipidemia. B. Hypertension. C. Atrial fibrillation. D. Asthma. The correct answer is hypertension. Valsartan is an ARB, angiotensin receptor blocker, used for high blood pressure. Question 76. A 13-year-old girl is fitted with a brace for scoliosis. Which statement indicates effective use? A. I only wear it at night. B. I look forward to taking this off for my bath. C. I can take it off when I go to parties. D. I can take it off whenever I am tired. The correct answer is I look forward to taking this off for my bath. The brace is worn 23 hours a day, removed only for bathing/hygiene. Question 77. Which nursing intervention is appropriate for idiopathic thrombocytopenic purpura, ITP? A. Administer stool softeners. B. Administer aspirin. C. Encourage vigorous coughing. D. Restrict fluids. The correct answer is administer stool softeners. Stool softeners prevent straining, which could cause rectal bleeding in a patient with low platelets. Question 78. A man in a psych unit is walking the halls naked, mania. How should the nurse respond? A. Quietly escort the point to his room and help him dress. B. Ask others to go to their rooms. C. Confront the point and demand he dress. D. Threaten seclusion. The correct answer is quietly escort the point to his room and help him dress. The nurse should protect the patient's dignity and safety in a calm, non-confrontational manner. Question 79. A doctor not involved in your client's care asks for their HbA1c. How should you respond? A. Ask the clerk. B. Tell him the value. C. Tell him to look it up. D. State I can't give you that information. The correct answer is state I can't give you that information. Sharing information with providers not involved in the care is a HIPAA violation. Question 80. A 15-year-old male's left leg is placed in skeletal traction. The primary purpose is to A. Reduce pain. B. Align the ends of the fractured bone. C. Promote bone healing. D. Control bleeding. The correct answer is align the ends of the fractured bone. Traction is primarily used to align the bone fragments. Question 81. To assist a post-appendectomy patient to start walking, the nurse will A. Tell the point to pull herself up. B. Assist to sit, stand, walk immediately. C. Dangle legs, then assist to stand, then walk. D. Keep the patient in bed. The correct answer is dangle legs, then assist to stand, then walk. Dangling allows the patient to adjust to position changes and prevents orthostatic hypotension. Question 82. When planning care for an infant with dehydration, which intervention is most accurate for monitoring hydration? A. Checking electrolytes. B. Assessing skin turgor. C. Monitoring daily weight. D. Measuring intake. The correct answer is monitoring daily weight. Daily weight is the most sensitive indicator of fluid volume loss or gain. Question 83. The nurse is providing care for a point with ALS. Which question indicates understanding of the disease nature? A. How do I execute an advance directive? B. How do I halt worsening? C. How do I prevent contamination? D. How many achieve remission? The correct answer is how do I execute an advance directive? ALS is progressive and terminal. Asking about advance directives shows acknowledgement of the prognosis. Question 84. The nurse is administering an influenza vaccine. What is a common side effect to warn the patient about? A. Pain at the injection site. B. Tinnitus. C. Constipation. D. Blurred vision. The correct answer is pain at the injection site. Soreness, redness, or swelling at the injection site are common side effects. Question 85. A point has SIAD. Which sign indicates improvement after treatment? A. Rise in blood pressure. B. Increased urine output. C. Increased urine osmolality. D. Decreased body weight. The correct answer is increased urine output. SIAD causes fluid retention. Increased urine output indicates the condition is resolving. Question 86. A point is on heparin. PTT is 60 seconds, control 30. What is the appropriate action? A. Administer protamine sulfate. B. Stop infusion. C. Notify physician. D. Do nothing. The PTT is therapeutic. The correct answer is do nothing. The PTT is therapeutic. Therapeutic PTT is 1.5 to 2.5 times the control. 30x2 equals 60, so the level is perfect. Question 87. Before suctioning a patient on a ventilator, the nurse hyperoxygenates the patient to A. Prevent cardiac arrhythmias. B. Prevent pulmonary hypertension. C. Prevent emphysema. D. Prevent gagging. The correct answer is prevent cardiac arrhythmias. Suctioning removes oxygen. Hyperoxygenation prevents hypoxia-induced arrhythmias. Question 88. Which instruction is correct for a muscle strain? A. Apply heat first, then ice. B. Apply ice packs for the first 48 hours, then heat. C. Start weightlifting immediately. D. Massage vigorously. The correct answer is apply ice packs for the first 48 hours, then heat. Ice reduces initial swelling/inflammation, heat is applied later for healing. Question 89. Acute respiratory distress syndrome, ARDS, results from A. Severe acidosis, B. Pulmonary hypertension, C. Increased permeability of pulmonary capillaries, D. Pulmonary edema. The correct answer is increased permeability of pulmonary capillaries. ARDS is caused by damage to the capillary membrane, leading to fluid leaking into alveoli. Question 90. A child with nephrotic syndrome eats poorly. How can the nurse help achieve dietary intake? A. Serve her favorite food, B. Play with her while eating, C. Avoid snacks, D. Give candy as reward. The correct answer is serve her favorite food. Serving favorite foods, within dietary limits, encourages intake in anorexic children. Question 91. The nurse explains the cause of bipolar disorder is A. Genetic factors, B. Environmental factors, C. Physiological factors, D. All of the above. The correct answer is all of the above. Bipolar disorder is likely caused by a combination of biological, genetic, and environmental factors. Question 92. A stable patient ingested 2 doses of digoxin. Which treatment is indicated? A. Symptomatic treatment/observation, B. Digoxin immune fab, C. Charcoal, D. Atropine. The correct answer is symptomatic treatment/observation. If the patient is stable, observation and monitoring are usually sufficient. DG bind is for toxicity. Question 93. Which signs are associated with hemolytic uremic syndrome, HUS? A. Hematuria and fever, B. The extreme fatigue, decreased urine output, bloody stool, C. Fever and dyspnea, D. Tachypnea and rash. The correct answer is extreme fatigue, decreased urine output, bloody stools. HUS is characterized by hemolytic anemia, fatigue, thrombocytopenia, bleeding, and renal failure, low urine. Question 94. The nurse assessing a child with coarctation of the aorta would expect A. Cyanosis, B. A diminished or delayed femoral pulses, C. Exercise intolerance, D. Poor feeding. The correct answer is diminished or delayed femoral pulses. Coarctation is a narrowing of the aorta, causing high BP in arms and low BP/pulses in legs. Question 95. In which stage of separation anxiety does the child act sad and apathetic? A. Despair, B. Detachment, C. Stoicism, D. Disassociation. The correct answer is despair. The stage of despair follows protest and is characterized by withdrawal and sadness. Question 96. Why are older adults at risk for excessive fluid loss? A. Increased thirst, B. Altered ADH response, C. Increased body fat, D. Decreased renal concentration of the urine. The correct answer is decreased renal concentration of the urine. Aging kidneys lose the ability to concentrate urine effectively, leading to fluid loss. Question 97. A patient on haloperidol develops tremors and a shuffling gait. These are A. Pacing, B. Seizures, C. Extrapyramidal side effects, D. Tics. The correct answer is extrapyramidal side effects. Tremors and shuffling, pseudoparkinsonism, are classic EPs of antipsychotics. Question 98. What sign checks for meningeal irritation? A. McBurney's sign, B. Ortolani's sign, C. Brudzinski's sign, D. Holman's sign. The correct answer is Brudzinski's sign. Brudzinski's sign, hips/knees flex when neck is flexed, indicates meningitis. Question 99. A patient admits to discontinuing Donepezil. This medication is used for A. Alzheimer's disease, B. Bipolar disorder, C. COPD, D. Cancer. The correct answer is Alzheimer's disease. Donepezil, Aricept, is used to treat symptoms of Alzheimer's dementia. Question 100. Which blood transfusion match would cause a hemolytic reaction? A. O negative to B negative, B. A negative to AB negative, C. B positive to B negative, D. B negative to B negative. The correct answer is B positive to B negative. Giving Rh positive blood to an Rh negative patient causes a reaction. Question 101. Diltiazem is used in the treatment of A. Deep vein thrombosis, B. Congestive heart failure, C. Hyperlipidemia, D. Arrhythmias. The correct answer is arrhythmias. Diltiazem is a calcium channel blocker used for atrial arrhythmias and hypertension. Question 102. Orthostatic hypotension is indicated by A. Rise in heart rate and a drop in blood pressure, B. A drop in heart rate and drop in blood pressure, C. Rise in heart rate and a rise in blood pressure, D. Drop in heart rate and rise in blood pressure. The correct answer is rise in heart rate and a drop in blood pressure. A drop in BP upon standing causes a compensatory rise in HR. Question 103. Which surgery for BPH is the least invasive? A. Retropubic prostatectomy, B. Perineal prostatectomy, C. Suprapubic prostatectomy, D. Transurethral resection of the prostate, TURP. The correct answer is transurethral resection of the prostate, TURP. TURP is performed through the urethra with no external incision. Question 104. When transferring a hemiplegic patient, which action needs correction? A. Moving towards unaffected side, B. Pulling the patient to a standing position by his arms, C. Telling patient to lean forward, D. Bracing the affected knee. The correct answer is pulling the patient to a standing position by his arms. Pulling by the arms can cause injury to the shoulder, especially in hemiplegia. Question 105. A patient with no cognitive function but sleep-wake cycles has A. Obtunded state, B. A persistent vegetative state, C. Locked-in syndrome, D. Brain death. The correct answer is a persistent vegetative state. Persistent vegetative state involves wakefulness without awareness. Question 106. Who is credited with the stages of cognitive development? A. Erickson, B. Piaget, C. Freud, D. Lister. The correct answer is Piaget. Jean Piaget developed the theory of cognitive development. Question 107. Which is considered an internal disaster? A. A patient fall, B. The massive spread of pneumonia, C. A computer hacking episode, D. Unexpected staff absences. The correct answer is a computer hacking episode. An internal disaster disrupts the facility's ability to function, example, power loss, IT failure. Question 108. Which tactile sensation test involves the nurse gently pricking the skin? A. Fine motor coordination, B. Stereognosis, C. 2-point discrimination, D. Gross motor function. The correct answer is 2-point discrimination. 2-point discrimination tests the ability to distinguish two distinct points on the skin. Question 109. Which technique is used to determine if a pulse is irregular? A. Apical pulse auscultation. B. Inspection. C. Palpation only. D. Percussion. The correct answer is apical pulse auscultation. Auscultating the apical pulse is the most accurate way to assess irregular rhythms. Question 110. What is the softening and thinning of the cervix during labor known as? A. Dilation. B. Asymphysis. C. Effacement. D. Hyperplasia. The correct answer is effacement. Effacement is the thinning/shortening of the cervix, dilation is the opening. Question 111. The fine, down-like hairs on a newborn are known as A. Vernix. B. Lanugo. C. Milia. D. Vibrissae. The correct answer is lanugo. Lanugo is the fine hair found on newborns. Question 112. Which position is best for hypovolemic shock? A. The Trendelenburg position. B. The supine position. C. The left lateral position. D. The right lateral position. The correct answer is the Trendelenburg position. Trendelenburg, or legs elevated, helps return blood to the heart and brain.